A resident with limited mobility needs to be transferred from their bed to a wheelchair. The nurse aide notices the wheelchair's brakes are not engaged. What should the nurse aide do first? A. Ask another staff member to hold the wheelchair in place. B. Lock the wheelchair brakes before transferring the resident. C. Place a foot on the wheelchair wheel to prevent it from moving. D. Transfer the resident quickly before the wheelchair moves. Answer: B. Safety is the top priority. Locking the wheelchair brakes prevents movement and reduces the risk of falls during transfer. This step should always be completed before moving the resident. During morning care, a resident with advanced arthritis complains of severe pain in their joints. The nurse aide is scheduled to assist with bathing. What is the most appropriate action? A. Proceed with the bath quickly to finish sooner. B. Report the pain to the nurse before continuing care. C. Offer a pain medication from the medication cart. D. Skip the bath and do nothing else. Answer: B. Nurse aides cannot administer medications but must report significant pain to the nurse so it can be addressed before continuing care. Comfort and safety must be maintained. A resident who is usually alert and talkative suddenly becomes confused and disoriented. What should the nurse aide do first? A. Assume the resident is just tired and let them rest. B. Call the family to report the change. C. Report the change to the nurse immediately. D. Give the resident fluids and monitor for improvement. Answer: C. Sudden confusion may indicate serious medical issues such as infection, low blood sugar, or stroke. Prompt reporting allows rapid assessment and treatment. A resident with diabetes refuses to eat breakfast but has already received their insulin. What is the nurse aide's best immediate action? A. Encourage the resident to eat something, even if small. B. Leave the resident alone until lunchtime. C. Offer sugary snacks without telling the nurse. D. Tell the resident insulin works even without food. Answer: A. Insulin lowers blood sugar. Without food, the resident risks hypoglycemia. Encourage some food intake and report to the nurse. While feeding a resident who has difficulty swallowing, the nurse aide notices the resident starts coughing and turning red. What should the nurse aide do first? A. Call the nurse and continue feeding. B. Stop feeding immediately and check airway. C. Give the resident water to wash down the food. D. Pat the resident on the back until they swallow. Answer: B. Coughing and redness can signal choking. Stop feeding, ensure airway safety, and get help if the resident cannot clear the obstruction. During toileting, a resident suddenly grabs their chest and says they feel dizzy. What should the nurse aide do first? A. Help them stand up and walk to bed. B. Leave them alone and find the nurse. C. Stay with them, call for help, and assist to a safe position. D. Give them their prescribed heart medicine. Answer: C. The resident may be experiencing a heart event. Stay with them for safety, call for immediate help, and position them safely until the nurse arrives. A confused resident keeps pulling out their oxygen tubing. The nurse aide needs to reapply it but the resident resists. What is the most appropriate response? A. Forcefully put the tubing back on. B. Explain the importance in simple terms and try again calmly. C. Restrain the resident until they comply. D. Remove the oxygen permanently. Answer: B. Communication should be respectful and calm. Use short, simple explanations and reassurance to encourage cooperation. A resident has a care plan that requires repositioning every 2 hours to prevent pressure ulcers. The nurse aide finds the resident has been in the same position for over 3 hours. What should the nurse aide do? A. Ignore the schedule and let the resident rest. B. Only turn the resident if they ask. C. Wait until the next scheduled round to reposition. D. Reposition the resident immediately and document the change. Answer: D. Extended pressure on skin can cause breakdown. Repositioning as soon as possible helps maintain skin integrity. While walking with a resident in the hallway, the resident suddenly becomes weak and begins to slump. What is the nurse aide's best action? A. Quickly pull the resident upright to keep them standing. B. Support the resident and help guide them to the floor safely. C. Let the resident fall and then call for help. D. Run to get help and leave the resident alone. Answer: B. If a fall is unavoidable, control the descent to prevent injury. Never leave the resident unsupported. A resident with limited mobility needs their bed raised for care. While adjusting the bed, the nurse aide notices the electrical cord is frayed. What should the nurse aide do? A. Continue using the bed until maintenance arrives. B. Tape over the frayed area to use it safely. C. Stop using the bed and report the hazard immediately. D. Ignore the issue since it's not affecting care yet. Answer: C. Frayed cords are an electrical hazard. Stop using the equipment and report it to prevent injury. While providing morning care to a resident with advanced Parkinson's disease, you notice that they have difficulty holding the toothbrush due to hand tremors. What is the most appropriate CNA action to promote independence? A. Brush the resident's teeth entirely for them. B. Provide an electric toothbrush with a larger handle grip. C. Tell the resident to skip brushing to avoid frustration. D. Hold the resident's hand steady without asking for permission. Answer: B. Providing an adaptive device, like an electric toothbrush with a larger grip, allows the resident to maintain as much independence as possible while accommodating their physical limitations. A resident recovering from hip surgery states, "I'm afraid to get out of bed because it hurts." The care plan encourages early ambulation. What should the CNA do first? A. Report the refusal to the nurse immediately without further discussion. B. Offer to walk with the resident and explain how it helps recovery. C. Ignore the concern and proceed with assisting the resident out of bed. D. Wait until the resident feels completely pain-free before walking. Answer: B. Educating and reassuring the resident about the benefits of walking post-surgery helps reduce fear and promotes adherence to the care plan. During breakfast service, you see a resident coughing repeatedly after taking a sip of water. The resident has a history of dysphagia. What should you do first? A. Offer thickened liquids as per their care plan. B. Pat them on the back vigorously to help them swallow. C. Encourage them to drink more water quickly. D. Ignore the cough since it is minor. Answer: A. Residents with swallowing difficulties should receive prescribed texture-modified diets, such as thickened liquids, to prevent aspiration. While transferring a resident from bed to wheelchair using a gait belt, you notice the resident's knees begin to buckle. What is your safest response? A. Hold the resident upright until they regain strength. B. Lower the resident gently to the floor while protecting their head. C. Quickly push the resident into the wheelchair regardless of position. D. Call for another CNA without supporting the resident. Answer: B. A controlled lowering to the floor protects the resident from injury and is the correct safety technique when a fall is unavoidable. A resident with advanced Alzheimer's disease becomes agitated during evening care, shouting and trying to push you away. Which approach is most likely to help? A. Speaking loudly and firmly to gain control. B. Using calm reassurance and offering a familiar comfort item. C. Continuing care despite their resistance to maintain routine. D. Leaving the room and avoiding all future care attempts. Answer B. Calm reassurance and familiar objects help reduce anxiety in dementia patients and encourage cooperation. A resident complains of chest tightness and shortness of breath while you are helping them dress. What is the first thing you should do? A. Assist them to lie down and call the nurse immediately. B. Tell them to finish dressing quickly to rest afterward. C. Leave the room to get another staff member without saying anything. D. Offer them a drink of water and continue dressing. Answer A. Sudden chest pain and breathing difficulty may indicate a medical emergency. Assist the resident to a safe position and alert the nurse right away. While taking a resident's pulse, you notice it is irregular. What is the correct CNA action? A. Record normal unless the resident complains of symptoms. B. Inform the nurse immediately for further assessment. C. Attempt to diagnose the condition yourself. D. Ignore it because irregular pulses are common in the elderly. Answer B. Any abnormal vital sign should be promptly reported to the nurse for evaluation. A resident's care plan states they must be repositioned every 2 hours. You arrive to find them sleeping soundly at the scheduled time. What should you do? A. Wake the resident and reposition them as per the care plan. B. Skip repositioning to avoid disturbing their rest. C. Wait until the resident wakes naturally before repositioning. D. Document that they refused repositioning. Answer A. Preventing pressure injuries requires consistent repositioning, even if the resident is asleep. During feeding, a resident suddenly becomes pale, clutches their throat, and cannot speak. What is your immediate action? A. Perform abdominal thrusts, Heimlich maneuver. B. Offer them water to clear the throat. C. Ask if they can cough. D. Call the nurse and wait for instructions. Answer A. These are classic signs of choking. Abdominal thrusts should be initiated immediately to clear the airway. A resident in a long-term care facility refuses to take a prescribed medication offered by the nurse. As the CNA assisting, what is your role? A. Try to convince them forcefully to take the medication. B. Document the refusal yourself. C. Respect their choice and report it to the nurse. D. Hide the medication in their food. Answer C. CNAs must respect resident rights and report refusals to the licensed nurse for follow-up. You notice a resident with diabetes has not eaten their lunch and appears shaky and sweaty. What is the first action you should take? A. Offer them dessert to encourage eating. B. Allow them to skip the meal and rest. C. Notify the nurse immediately and check their care plan for hypoglycemia protocol. D. Give them water and wait for improvement. Answer C. Shakiness and sweating may indicate low blood sugar. The nurse must be notified and the care plan followed promptly. During morning rounds, you find a resident on the floor near their bed, conscious but upset. What should you do first? A. Help them back into bed right away. B. Check for injuries before moving them and call the nurse. C. Scold them for getting up without assistance. D. Leave to get help without speaking to them. Answer B. Safety requires assessing for injury before movement and reporting falls immediately. While assisting a resident in the shower, you notice a new skin tear on their forearm. What is your immediate responsibility? A. Finish the shower and clean it later. B. Apply lotion and cover it. C. Stop bathing, protect the area, and report it to the nurse. D. Ignore it since small tears are common. Answer C. New injuries must be addressed promptly to prevent infection and documented per policy. A resident with COPD asks you to open the window in their room for fresh air. The temperature outside is below freezing. What is the best action? A. Refuse because cold air is dangerous for all residents. B. Open the window slightly and ensure they are dressed warmly. C. Open the window fully for maximum airflow. D. Tell them to wait until spring for fresh air. Answer B. Meeting resident preferences while maintaining safety and comfort is key. Controlled ventilation is a safe compromise. A resident is upset because they have not had a bowel movement for 3 days. What is the most appropriate CNA response? A. Offer them laxatives without nurse approval. B. Tell them it is not a CNA's concern. C. Ignore the complaint until the next bowel movement. D. Encourage fluids, mobility, and report to the nurse. Answer D. Constipation should be addressed with nurse notification and promoting diet and activity that support bowel health. During an activity session, a resident becomes confused and tries to leave the facility. What should you do? A. Block the exit and shout for them to stop. B. Calmly redirect them to a safe location and notify the nurse. C. Let them leave to avoid confrontation. D. Call their family to come get them immediately. Answer B. Redirection and ensuring safety are the first priorities in cases of wandering. A resident with hearing impairment is having trouble understanding you. What is the best communication method? A. Speak more loudly into their ear. B. Communicate only through writing. C. Use long, complex sentences to be precise. D. Face them directly and speak clearly at a normal pace. Answer D. Good lighting, direct facing, and clear speech at a normal pace improve comprehension for hearing-impaired residents. A new CNA on your shift is about to transfer a resident without locking the wheelchair brakes. What should you do? A. Wait until they make a mistake and then correct them. B. Immediately stop and remind them to lock the brakes for safety. C. Let them continue since they are experienced. D. Report them after the transfer without intervening. Answer B. Preventing harm in real time is a CNA's duty. Stopping unsafe actions protects the resident. While measuring blood pressure, the resident's sleeve is tight around their arm. What is the best approach? A. Measure over the sleeve to save time. B. Roll the sleeve tightly above the cuff. C. Remove or loosen the sleeve to allow accurate measurement. D. Skip the reading and record unable to measure. Answer C. A tight sleeve affects accuracy. The cuff must be applied directly to the bare arm. A resident tells you they feel lonely and have no one to talk to. What is your best response? A. Ignore the comment and continue your work. B. Offer to sit and chat briefly and notify activities staff. C. Tell them to watch TV instead. D. Advise them to talk to other residents on their own. Answer B. Offering companionship and connecting residents with social opportunities supports emotional well-being. While assisting a resident who is recovering from a hip replacement surgery, the CNA notices the resident attempting to cross their legs while sitting. What is the most appropriate immediate action? A. Remind the resident to keep legs uncrossed to avoid hip dislocation. B. Allow the position since it may reduce discomfort. C. Adjust the chair height so the legs hang freely. D. Place a pillow between the knees for comfort without repositioning. Answer A. After hip replacement, crossing legs can risk hip dislocation. CNAs must remind and assist the resident to maintain safe positions according to postoperative precautions. A CNA is caring for a resident who has a do not resuscitate (DNR) order but suddenly becomes unresponsive and pulseless. What should the CNA do first? A. Begin chest compressions immediately. B. Call the nurse and follow facility protocols for DNR. C. Check for an advance directive in the resident's file before acting. D. Administer rescue breaths only. Answer: B. DNR orders legally instruct staff not to perform CPR. The CNA must notify the nurse immediately and follow facility protocol, which may involve comfort care instead. While feeding a resident with advanced Parkinson's disease, the CNA notices the resident coughing after each spoonful. What should be the CNA's priority? A. Continue feeding slowly while monitoring. B. Stop feeding and alert the nurse for possible swallow evaluation. C. Offer water to help wash down the food. D. Switch to a liquid-only diet immediately. Answer: B. Repeated coughing during feeding may indicate dysphagia, increasing aspiration risk. Feeding should stop and the nurse should be notified for a swallow assessment. A CNA enters a resident's room and finds them on the floor with a minor cut on the hand. What is the first step the CNA should take? A. Clean the wound immediately. B. Help the resident back to bed quickly. C. Stay with the resident and call for the nurse. D. Complete an incident report before doing anything. Answer: C. Safety and assessment come first. The CNA should stay with the resident, ensure they are stable, and call for the nurse before moving them. During morning care, a resident becomes short of breath after walking a few steps. The CNA should: A. Encourage them to continue walking to build stamina. B. Sit them down immediately and notify the nurse. C. Ask them to lie flat for easier breathing. D. Offer a glass of water and observe for improvement. Answer: B. Sudden shortness of breath is a potential medical emergency. Stopping activity and notifying the nurse ensures prompt evaluation. While taking vital signs, the CNA notices a resident's pulse is irregular and significantly slower than their usual readings. What should the CNA do? A. Finish all vital signs before reporting. B. Document it but no need to inform immediately. C. Ignore the reading if the resident feels fine. D. Repeat the pulse count to confirm accuracy, then notify the nurse. Answer: D. Abnormal or irregular vital signs require verification and prompt reporting to the nurse for assessment. A resident with dementia starts shouting and hitting during bathing. What is the most appropriate CNA response? A. Continue bathing quickly to finish the task. B. Step back, ensure safety, and try again later using a calm approach. C. Call another staff member to restrain the resident. D. Leave the room and return much later without explanation. Answer: B. Agitation may be triggered by discomfort, fear, or confusion. Safety and respect require pausing and reapproaching calmly. A CNA finds that a resident's urinary catheter tubing is kinked and the drainage bag is empty despite the resident drinking fluids. What should the CNA do? A. Straighten the tubing and ensure the bag is below bladder level. B. Remove the catheter immediately. C. Encourage the resident to drink more water. D. Ignore it and check again during the next round. Answer: A. Kinks in catheter tubing can block urine flow, causing discomfort and infection risk. The CNA must fix the tubing position promptly. During a transfer from wheelchair to bed, the resident suddenly says they feel dizzy. The CNA should: A. Quickly lift the resident to bed to avoid falls. B. Sit them back in the wheelchair and monitor until stable. C. Ignore the symptom if the transfer is almost done. D. Call the nurse while continuing the transfer. Answer B. Dizziness can indicate low blood pressure or other issues. The safest action is to seat the resident and wait for stability before resuming. While assisting a resident with oral care, the CNA notices small white patches inside their mouth. What should the CNA do? A. Scrub the patches off with a toothbrush. B. Report the findings to the nurse immediately. C. Offer mouthwash and continue care. D. Ignore the patches if the resident feels no pain. Answer B. White patches can indicate oral thrush or other conditions requiring medical evaluation. The CNA should report observations promptly. A CNA is helping a resident with advanced COPD get dressed when the resident becomes visibly anxious and breathless. What is the best immediate action? A. Encourage deep breathing and slow movements. B. Ask the resident to hold their breath while dressing. C. Continue dressing quickly to reduce exposure to cold. D. Lay the resident flat on the bed. Answer A. COPD patients may experience shortness of breath with exertion. Encouraging calm breathing and pacing helps prevent distress. While documenting care, the CNA realizes they accidentally wrote in the wrong residence chart. What should they do? A. Erase the entry and rewrite it correctly. B. Draw a single line through the mistake, label error, and initial it. C. Tear the page out and start over. D. Leave it and hope it is not noticed. Answer B. Proper charting requires transparent correction without erasing. The correct method is to strike through, label, and initial. A resident complains of pain in their lower back after being in bed for several hours. The CNA notices redness over the sacral area. What should the CNA do? A. Massage the area to improve blood flow. B. Ignore unless the redness worsens. C. Apply lotion and cover with a blanket. D. Reposition the resident and notify the nurse. Answer D. Redness over bony areas can be a sign of pressure injury. Repositioning and prompt reporting help prevent worsening. During mealtime, a resident with vision loss asks where their food items are located. What is the most helpful CNA response? A. Place all food items in random positions. B. Use the clock method to describe item locations. C. Feed the resident without explaining. D. Ignore the request and let them find the food by touch. Answer B. The clock method gives clear orientation, improving independence and dignity during meals. A CNA is caring for a resident who refuses to participate in physical therapy, stating they are too tired. What should the CNA do first? A. Encourage participation by explaining the benefits. B. Report refusal to the nurse and therapist. C. Force gentle movements to avoid stiffness. D. Ignore the session entirely. Answer A. Encouragement and education about benefits can help overcome reluctance, but refusal must also be documented and reported. A CNA notices that a resident's bed is wet with urine despite them wearing an incontinence brief. What is the most likely first step? A. Check if the brief is saturated or leaking and change it. B. Increase the resident's fluid intake. C. Avoid changing the bed until later to save supplies. D. Tell the resident not to drink before bedtime. Answer A. A wet bed may result from a saturated or improperly fitted brief. The CNA should address hygiene promptly. While transporting a resident in a wheelchair, the CNA approaches a ramp. What is the safest method? A. Push the wheelchair facing forward down the ramp. B. Back the wheelchair down the ramp slowly. C. Let the wheelchair roll down without assistance. D. Carry the resident instead. Answer B. Backing down ramps prevents tipping forward and ensures greater control of the wheelchair. A resident with diabetes refuses their evening snack. The CNA should A. Respect the refusal without further action. B. Offer a different snack without telling the nurse. C. Inform the nurse since missing a snack could affect blood sugar. D. Encourage them to skip the snack for weight control. Answer C. Skipping a snack can cause hypoglycemia in diabetic residents, and this must be reported to the nurse. While assisting with perineal care, the CNA notices signs of skin irritation. What should they do? A. Apply powder immediately. B. Document and report the irritation to the nurse. C. Use hot water for cleaning to kill bacteria. D. Ignore if the resident doesn't complain. Answer B. Skin irritation may require medical or nursing intervention. Reporting ensures appropriate care is given. A resident becomes unusually withdrawn and tearful over several days. The CNA's best first step is to A. Assume they are just tired. B. Tell them to cheer up and think positively. C. Avoid engaging to give them space. D. Gently ask if something is bothering them and report observations. Answer D. Emotional changes can indicate depression or illness. CNAs should engage with empathy and communicate findings to the nurse.